Good afternoon, everyone. Are you ready to begin? Okay. So now we move to agenda item 12, Health Financing Document WPR/RC75/7. May I invite the Regional Director to introduce this item, please?
Thank you, Madam Chair. Distinguished representatives, I'm pleased to introduce document WPR/RC75/7, the Draft Regional Action Framework for Health Financing to achieve universal health coverage and sustainable development in the Western Pacific for consideration by the Regional Committee. No health system can function without adequate, equitable, efficient, and sustainable financing. Over the past 2 decades, countries and areas in the Western Pacific region have made great strides with ambitious health financing reforms. Millions more people can now access essential health services and enjoy longer and healthier lives. This remarkable progress could not have been achieved without robust public investment in the health sector. While these achievements merit praise, many challenges in health financing persist. The level of government spending on health in many countries remains insufficient to meet the growing health needs of their people. Out-of-pocket spending on health has been constantly on the rise, putting many families at risk of financial hardship when paying for health services. Primary health care, as we heard during the panel discussion, is the cornerstone of universal health coverage. Yet it is still not sufficiently prioritized and chronically underfunded. And what funding is available is often not spent in the most equitable or efficient manner, leaving the most vulnerable populations behind. Meanwhile, our health systems are under increased pressure from the rising burden of non-communicable diseases, age-related health needs, emerging health security threats, and the health risk related to climate change and other environmental challenges. Unless we take decisive action now, these challenges could endanger the financial sustainability of our health systems and the well-being of our societies. So the question, what can we do? For starters, public spending on health must be increased and understood as an investment rather than a cost. But even that will not be enough. Resources must be managed more equitably and strategically, but above all, we must be accountable to ensure that public investment results in improved population health outcomes and broader social benefits. To accomplish this, we have to broaden our focus to address determinants of health, both within and beyond the health sector, building on a people-centered primary healthcare approach. Ministries of health must take bold steps to handle changing environments by using financial mechanisms to promote healthier lifestyles and ensuring health systems are resilient to climate change and health security threats. In the long term, we must ensure that the health and well-being are at the center of the broader sustainable development agenda. This means engaging with stakeholders outside the health sector at every step. These include finance and other government ministries, development partners, academic institutions, civil societies, and communities. In collaboration with member states and partners, WHO developed the Draft Regional Action Framework in order to consolidate lessons learned from the past and set policy priorities on health financing for the future. The framework represents our collective effort in weaving health into the fabric of economic and social development. The Regional Committee is invited to consider for endorsement the Draft Regional Action Framework on health financing to achieve universal health coverage and sustainable development in the Western Pacific. Thank you, Madam Chair.
Thank you, Dr. Pukala, Regional Director. I understand the Secretariat has prepared a video on this item. Please play the video. Thank you. We will now hear from representatives who wish to speak on this item. Please indicate your wish to speak by clicking the big button on your microphone. Please. So I call on Philippines, followed by Cambodia. Philippines, please.
Thank you, Madam Chair. The Philippines strongly recommends the endorsement of the Regional Action Framework for Health Financing to achieve universal health coverage and sustainable development in the Western Pacific. This is highly relevant given to the Philippines' current health financing landscape. As of 2023, the Philippines' household out-of-pocket expenses still account for a significant 44% of the total current health spending, and the government's stagnant health expenditure positions as third to the last among ASEAN countries in terms of government health spending share. Additionally, there has been a concerning decline in PhilHealth's contribution, dropping from 13.2% in 2022 to just 10.2% in 2023 of the total health spending. Furthermore, 37.7% of health spending in 2023 is allocated to curative care, followed by 31.8% to pharmaceuticals, while less than 10% is directed towards primary health care. We are committed to addressing these challenges through our Healthcare Financing Strategy 2023 to 2028, focusing on 4 key areas. First, we aim to increase public funding by raising taxes on harmful products, empowering local government units to allocate more for health, and tapping alternative funding sources through well-thought-out loans and grants, improving premium collection through the enrollment of the informal sector, and efficient budget execution of governmental institutions, specifically the Department of Health and the Philippine Health Insurance Corporation. Second, we will strengthen primary care financing by investing in resources, ensuring benefit access, and maintaining quality service delivery. Third, we will focus on equitable financing by aligning programs with the National Health Insurance, improving payment mechanisms, and ensuring zero co-payment for basic accommodations, and making medicines affordable by ensuring transparency on price information, advocating for generic medicines, increasing competition in the pharmaceutical market's price information sharing, and price regulation if necessary. Lastly, we will also promote the transparency and accountability through enhanced digital systems, stronger financial management, and raising public awareness of health rights. These strategies are vital for ensuring financial risk protection for all Filipinos and building a resilient and equitable health system towards UHC. The issue of low public health spending remains a significant barrier to achieving UHC, even for middle-income countries like the Philippines. It is imperative to strengthen tax systems and advocate for reallocation of government resources towards health. We aim to increase fiscal space by broadening the revenue base and improving efficiency in public financial management. While recognizing the importance of external funding, our approach will prioritize domestic investments to ensure sustainability. We are committed to reducing fragmentation by harmonizing funding streams to promote more equitable distribution of resources. The move from fee-for-service to value-based payment models is essential, ensuring that health spending drives both quality and efficiency in service delivery. Investing in technology to enhance procurement processes and health system management will optimize the use of public resources. It is also imperative to explore innovative financing as results-based financing to ensure sustained investment in primary health care, which is a cornerstone for achieving UHC. Further, the involvement of finance ministers and other public sector actors are crucial in addressing bottlenecks of health reforms. Our commitment to a health in all policies approach reflects cross-sectional strategies to tackle the root causes of health inequities and ensure long-term sustainability in UHC. Health financing reforms are crucial for our journey towards UHC. They help us ensure that resources are fairly distributed, that our health system runs efficiently by focusing on the right priorities, and that we maintain transparency and accountability of our people. The Philippines remains committed to advancing financial protection and achieving equitable access to quality healthcare. The Regional Action Framework serves as a critical tool for guiding our reforms in health financing, and we believe that the lessons from our journey can offer insights for other member states. While each country must navigate its unique challenges, collaboration and shared learning will strengthen our collective efforts towards achieving universal health coverage and building resilient health systems across the region. Thank you, Madam Chair.
Thank you. I call on the representative of Cambodia, followed by China.
Thank you, Madam Chair. Cambodia commends the work of the Secretariat for developing the trust, the Regional Action Framework for Health Financing to achieve universal coverage and sustainable development in the Western Pacific. I recommended at the 74th sections of the Regional Committee last year. We note that the framework is built on the latest global and regional evidence through consultative process and expert and member state consultations with robust situation analysis, highlighting health financing progress and challenges in the regions. Additionally, the frameworks appropriately reflects a resolution adopted by the 77th World Health Assembly this year, calling on the WHO and member states to consider the interlinkages between economies and social well-being and to promote health for all as the policy goal beyond the health sector, supported by fit-for-purpose health financing policies. Cambodia endorsed the Draft Regional Action Framework for Health Financing to achieve universal coverage in the Western Pacific, which proposed a set of strategic actions which are categorized into 5 action domains. We believe that the frameworks will provide the guidance for the current work of Cambodia's Ministries of Health and WHO and other health partners in developing a strategy for sustainable and equitable health financing in Cambodia. This includes, but is not limited to, the following main activities: reviewing and updating the health service package for the different levels of care, including reprioritized health benefit package for the social health protection scheme with costings to inform effective planning and budgeting as well as financial management. Second, redesigning structured payment system, including payment mechanism that create appropriate incentive for health providers to improve healthcare qualities and focusing on prevention, early intervention, and care coordinations. And last, aligning activity and resources are the key actors, including private sector, with the national health and social protection priorities, moving toward achieving Cambodia UHC objectives. We are looking forward for the guidance and support of the WHO and also the collaboration with the member states. Thank you, Madam Chair.
Thank you. I call on the representative of China, followed by Singapore.
好，谢谢。谢谢主席。中国赞赏世卫组织西太区在推动全民健康覆盖、改善健康公平方面所做的不懈努力，以及在这方面取得的重要进展。正如大家都知道，全民健康覆盖是联合国2030年可持续发展议程健康目标的重要内容。2023年9月，联合国大会全民健康覆盖高级别会议进一步敦促各国履行政治承诺，逐步实现全民健康覆盖。从各国实践和面临的挑战来看，完善卫生筹资对实现全民健康覆盖具有重要意义。
is pivotal for achieving UHC.
加强卫生
We
筹资
believe strengthening
是
health
增加
financing
优质医疗服务供
is
给，
fundamental to increasing the supply of high-quality medical services and expanding
近
UHC.
年来，
Over
中
recent
国政
years,
府
the
通过立法
Chinese
将医疗
government
卫生
has
与健康
incorporated
促进
funding
相
for
关的经费
healthcare
纳
and
入了政府预算，
health promotion
并
into
加大
government
卫生筹资的力度，
budgeting through
全力推进实现
legislation,
全民健康
increased
覆盖。
health financing efforts, and
广义
made
政
all
府
our
卫生
efforts
支
to
出
achieve UHC.
由
Government
2012
total health
1.6
expenditure
万亿
increased
元
from
增长至
1.6 trillion
2023
RMB yuan to
5.1万亿
2012
元。
to 5.1 trillion
同
yuan
时，
in
中方注意到
2023. At the same
我
time,
们期望
China
组
has
建
taken
附件
note
所载的行
that
政框架草案，
in
我
the
们支持该草案的通
annex,
过。
we
此外，
are supportive
我们倡导
of this
要
document
建立可持续
number
的
7,
卫生筹资策略，
and
加大
we
和
advocate for the
保障卫
establishment
生
of
事业的
sustainable
公
health
共经费投
financing
入，
strategies to
以
increase
公平
and
为导向，
secure public
明
funding
确
for
基本卫生服务
health.
由公共
Clarify
财政
that
覆盖。
primary health
统筹
care
多
is
渠道的
funded by
疾病预
public
防和
finance to
治
achieve
疗
health
等卫生经
equity.
费，
Coordinating multi-channel health
和一
funding
线服务
for
提供
disease
者的
prevention
经
and
费充
treatment to
足。
ensure adequate
同
funding
时，
for primary
我们
health
呼
care
吁为基础
institutions
国
and
家
the
实现
frontline
全民健康覆盖，
professionals. At the
提
same
供
time,
可持续
we
的
would
资
call
金
for
支持。
sustainable funding support
今天上
to
午，
low-income
世卫组
countries
织
for achieving
驻华代
UHC.
表马丁先生
This
介
morning,
绍了
Mr.
我们的
Martin
合作项
Taylor,
目，也就
representative
是
of WHO
促
to
进以
China,
人
talked
为本
about
的
our
整合型
our
卫生服务体系建
PCIC
设。
program, a
PCIC
pilot
项目，
project,
我们
PCIC
感
in
谢
abbreviation,
世卫
an
组织
integrated
和
primary
驻华代表
healthcare
处
project.
对
I'd like to
中
thank
国的支持。
WHO and its China office
中国
for your
愿
support
继
in
续
China.
同
China
国际
stands
社会一
ready
道，
to collaborate
积
with the
极推动
international
卫生健
community
康
to
交
actively
流合
promote
作，
health
推动
exchanges
构建
and
人类卫
cooperation
生
while
健康
building
健康共
towards
同
a
体。
health community
这与我
for
们
all.
区域主任
And that
朱
is
卡拉医
highly
生提出的
aligned with
Weaving
Dr.
Health for All 治
Sayer
医院景的目标
Pulkala's
是一致的。
vision to
谢谢。
weave health for all. Thank you.
Thank you. I call on the representative of Singapore, followed by Republic of Korea.
Thank you, Chair. Singapore supports the WHO's draft regional action framework for health financing to achieve universal health coverage and sustainable development in the Western Pacific. A rigorous health financing framework is the cornerstone of a healthy healthcare system. With an aging population, rising prevalence of chronic diseases, and advancements in medical technology, healthcare costs can be expected to continue to increase. These trends underscore the need to explore innovative financing solutions that are adapted to our different local contexts. to maintain the sustainability of healthcare systems while working towards universal health coverage. We are striving to do this in Singapore. Allow me to briefly share our experiences. Our health financing framework is built upon the S plus 3 M's. The first S, subsidy, which is funded by taxation. The first M, MediSave, which is personal savings. Second M, MediShield Life, which is the national insurance scheme. And the last M, MediFund, which is the safety net. This framework is broad in providing Singaporeans with access to quality healthcare and also targeted in providing assistance to those who need it the most. We regularly review this framework to ensure that it continues to enable universality. For example, we have increased the qualifying income threshold for subsidies from 1st October this year, which is expected to benefit up to 1.1 million Singapore residents. We have also enhanced the subsidy frameworks for palliative care and community hospital settings. We also monitor medical advancements, which are often costly, to ensure that our population has access to novel and cost-effective treatments. Recognizing the need to reduce future healthcare cost burden, we have placed more emphasis upstream on preventive health. Through Healthier SG, we aim to build health instead of only treating residents when they fall sick. Healthier SG empowers Singaporeans to take proactive steps to manage their health, prevent onset of chronic diseases, and lead healthier lifestyles. In the long run, we hope that this will keep healthcare costs in check and healthcare capacity adequate. We thank the WHO for this timely framework, and we believe that it will significantly contribute to improving healthcare systems and outcomes across our region. Thank you.
Thank you. I call on the representative of the Republic of Korea, followed by Solomon Islands.
Thank you, Madam Chair. The Republic of Korea expresses its gratitude to the WHO Western Pacific Regional Office for its efforts in drafting the Regional Action Framework for health financing to achieve universal health coverage and sustainable development in the Western Pacific region. We express our concern regarding the factors hindering the progress towards universal health coverage, as highlighted in the report, including the stagnation in the expansion of healthcare coverage, the reduction in financial protection, and the rising healthcare expenditure. At this current critical juncture, faced with the overarching goal of achieving the 2030 SDGs, the Regional Action Framework suggesting a new approach and structural reform for health financing holds great significance. The Republic of Korea concurs with the health financing reforms outlined in the agenda, including increasing public financing, enhancing expenditure efficiency, strengthening effective governance, and eliminating health risk factors. In particular, we believe that appropriate investment is required for transitioning into a primary care-centered system. The importance of this shift has been increasingly emphasized recently, but sufficient expenditure is yet to be accumulated. The Korean government also is undergoing various reforms to enhance the sustainability and efficiency of our national health insurance financing. In particular, to address gaps in essential medical services, we have expanded compensation for high-cost essential services, supported the maintenance of essential healthcare infrastructure, and strengthened collaboration among medical institutions. To conclude, Korea hope that the sharing of best practices among WIPRO member states will help successfully implement the regional action framework for health financing to achieve universal health coverage and sustainable development, accelerating this progress toward achieving the SDGs and UHC across the whole Western Pacific region. Thank you.
Thank you. I call on the representative from Solomon Island, followed by New Zealand.
Thank you, Chair, for this opportunity. First, I wish to thank WHO, World Bank, ADB, DFAT, Australia, Japan through JICA, Korea, China, Gavi, UNICEF, UFPA, to name a few, for being our great partners in helping us to finance our health sector in Solomon Islands, most of which are our big brothers in the Western Pacific region. And really, it's according to the regional director, the long covers the short and the thick covers the thin. Public finance plays a crucial role in ensuring access to quality health care by reducing financial barriers and supporting universal health care coverage. Educate funding enhances health outcomes while also ensuring system efficiency through equitable resources allocation. The challenges highlighted are not unique to Solomon Islands, and I wish to respond by sharing our context and highlighting a couple of our challenges in health financing. The health sector, though consistently been a top priority in the government funding, receiving the second largest share of the total domestic budget. Its budgetary allocation have not kept pace with the growing demand of the population for health services. This is largely due to health budget being historically based on previous year's allocation rather than on needs-based estimates conducted by the Ministry of Health. With limited resources, the ministry conducts annual budget analysis to identify financial pressures and inform decision-making regarding resource allocation in managing cost pressures, while at the same time ensure continuity of essential healthcare services. The health sector benefits significantly from external financing, which supports various health programs. However, one of the key challenges is the low execution of the external budget support, with an average execution rate of only 60%. In 2022, the ministry conducted a budget execution case study, followed by a 2023 study focusing specifically on external budget support. These studies identified root causes of the low execution rate, informing the ministry's dialogue on potential reform. Key issues including the regularity of fund flows, the effectiveness of spending controls, and the robustness of procurement, human resource capacity to absorb substantial funds, and accountability mechanisms. Ministry of Health oversees both national and subnational health services, acting as both a regulator and funder for over 300 facilities. Because the annual budget ceilings for entire health services are predetermined outside the Ministry of Health and Medical Services, it limits our ability to cost effectively for subnational services. Therefore, any increase to subnational will reprogram within the ceiling at the cost of other health programs. The centralized nature of the health budget allocation has resulted in underfunding of primary healthcare services at the subnational level. In response, the ministry undertook a health spending and outcome mapping analysis in 2023 to assess whether increased financing capacity correlates with improved health outcomes. Thank you, Chair Lady.
Thank you. I call on the representative of New Zealand, followed by Vietnam.
Thank you, Chair. Tēnā koutou katoa. This framework recognises that health financing is highly context dependent and that countries would need to tailor the implementation of these strategic actions to their domestic priorities and needs. It highlights the need for strengthened governance functions and institutional capacity to promote more transparent, accountable and inclusive health financing systems. In doing so, the framework recognises the role of political dynamics and that dialogue with communities and other key stakeholders throughout the process are also critical success factors. In addition, the framework recognises that alongside greater reliance on public funding for health, it is equally important to spend funds wisely. More equitable and efficient health spending may be achieved by reducing the fragmentation of available resources, merging and harmonising public funding pools, as well as incentivising efficiency, equality and quality when allocating resources to health service providers. The New Zealand government's budget for 2024 included a significant investment to support timely access to quality healthcare. The package was focused on addressing increased costs faced by the health system, along with targeted new spending. This cost pressure uplift in health funding was applied to primary, community, population and public health services, as well as hospital and specialist services and Haora Māori Indigenous health services. The New Zealand health system has a ring fence for mental health and addiction expenditure. This aims to ensure that the amount spent on mental health and addiction services increases each year, at least in line with demographic and cost pressures, and that mental health and addiction expenditure is not reallocated to other service areas. New Zealand supports the endorsement of the Regional Action Framework on Rethinking Health Financing for universal health coverage and sustainable development. We thank the Western Pacific Regional Office, member states, partners and experts for their contribution into this framework. Ngā mihi nui. Thank you.
Thank you. I call on the representative of Vietnam, followed by Mongolia.
Thank you, Madam Chair. Vietnam actually supports the draft regional action framework for health financing to achieve universal health coverage and sustainable development in Western Pacific. The framework provides a menu of strategic actions for member states to consideration to address challenges and ensure the progress toward healthy and sustainable development. We definitely agree with 5 key action domains presented by the framework. In Vietnam, the government budget and social health insurance are 2 key public funding sources for the health sector in Vietnam. To increase the accuracy and sufficiency of government budget allocation, some solutions has been launched. The government conduct a pilot medium-term expenditure framework in the period of 2003 to 2011. Moreover, the MOS has been using a national health account as an effective tool to track the health spending over time, as well as the projection proposed. Since early 2000, an autonomous policy with 4 various degrees has been applied to public service providers to help relax the government budget and reform the public health financing. Regarding the social health insurance, we developed money mechanism and policies to help address the overspending issue and increase the financial sustainability. For example, global budget with a hookup of for social health insurance is expenditure in each province. The information technology application for the social health insurance claims review, and we also developed the reimbursement policy to revision and realize the indication of high-cost medicines. However, despite many efforts to increase the public financing, Vietnamese household OAP payments still high and have been a rising trend in recent years. Healthcare spending is not increasing as fast as the population growing healthcare needs, and the fee-for-service is the dominant provided payment method with issues such as the cost escalation and fragmentation of service delivery. On this occasion, we would like to sincerely thank WHO and other international development partners for all of the technical and financial support to our health system. We're looking forward to a fruitful collaboration with you in the coming year. Thank you.
Thank you. Now I give a floor to Mongolia, followed by Malaysia.
Thank you, Madam Chair. Good afternoon. Mongolia has been actively improving its health financing systems to enhance healthcare access and quality. In collaboration with WHO, the country has implemented key reforms aimed at achieving universal health coverage. The recent amendments to health law and the integration of the state budget with health insurance funds have resulted in unified funding approach. Hospitals are now fully financed through diagnosis-related group methods, and the Health Insurance General Agency has taken on strategic purchasing role, updating benefits packages and payment modalities. The capitation rates for primary health centers have doubled, with 20% linked to performance evolutions. In 2022, DRG adjusted tariffs, prescription drug reimbursements, and review criteria were updated, along with the introduction of regional coefficients and decentralization policies. Early detection benefits packages and volume-based contracting were introduced, along with increased wages and incentives for rural work. Despite the transition to output-based financing, challenges persist as input-based approaches continue to dominate in many areas. The WHO has been instrumental in facilitating policy dialogues and producing evidence to refine reforms and tackle implementation challenges. In 2024, WHO supported a progress review of Mongolia's health financing reforms that include data analyzing, interviews, and creation of comprehensive report to guide future monitoring and evaluation efforts. The key findings are greater government commitment to financing the health sector is crucial for sustainable improvements. The creation of single purchaser can improve efficiency, and early signs of orientation towards primary health care. While it's early to draw definitive conclusions, these multi-phased reforms are showing promising trend toward better healthcare outcomes, increased accessibility, and enhanced financial protection. Thank you for your attention.
Thank you. I call on the representative of Malaysia, followed by Samoa.
Thank you, Madam Chair. The draft Regional Action Framework for Health Financing in the Western Pacific acknowledges progress in expanding population coverage and pooling public fund, but calls for improved transparency, accountability, and clearer guidelines for private sector engagement in high out-of-pocket regions. In line with this framework, and WHO's recommendation, Malaysia is actively pursuing healthcare reforms to strengthen the healthcare system, exploring innovative and sustainable financing as outlined in our Ministry of Health White Paper. Echoing the Regional Action Framework for Health Financing, Malaysia aims to optimize few areas like resource allocation, diversify funding resources, enhance healthcare services delivery and efficiency, and tap into robust public-private partnership. Under the umbrella of Malaysia's health transformation, we will undertake key initiatives including implementing systematic and structural changes, building key capacities such as enhancing strategic purchasing, deploying shareable electronic medical records, improving governance and management, and introducing new integrated models of care. Malaysia acknowledges the critical role of public-private collaboration within our dichotomous healthcare system. Along with this, health financing, especially increasing public funding for health, is viewed as a critical long-term investment which can limit reliance on out-of-pocket payments. Investment in primary health care is also vital for universal health coverage and addressing non-communicable diseases. With WHO's support, Malaysia is committed to developing a health system that ensures universal access to essential services while safeguarding financial protection. A whole-of-government approach is vital, and Malaysia is ready to adopt the draft framework's recommendation to suit its population's specific needs. To conclude, Malaysia urges the Regional Committee to endorse this framework and commit to the decisive policy actions it outlines. This endorsement will signify a strong commitment to improving health financing system, and together we can ensure that everyone in the Western Pacific region has equitable access to quality health services without financial hardship, thereby advancing our shared goal for health for all. Thank you, Madam Chair.
Thank you. Now I give the floor to Samoa, followed by Australia.
Madam Chair, Honorable Ministers, ladies and gentlemen, Samoa would like to comment on our regional office for presenting the draft Regional Action Framework for Health Financing to achieve universal health coverage and sustainable development in our region. And we fully support the endorsement of this Regional Action Framework as a guiding instrument to assist our region with its effective management and monitoring of our health spending, effective utilization of our public funds to support our health systems, prioritization and security of health funds for primary health care, strengthening governance and leadership in health financing, and ensuring health for all are integrated in national, social, and economic policies. Samoa would also like to acknowledge the technical support by WHO in reviving and producing its national health accounts reports. We are looking forward to the completion of the recent NHA for financial years 2019 to 2020 and 2020 to 2021, which are the first two financial years of Samoa's existing health sector plan. The rationale behind producing NHA for this financial year was to determine whether Samoa's health sector implement programs, activities, and provide health services in accordance to its priority, which is strengthening its public health system and revitalization primary health care. In addition, Samoa's health sector is planning to foster the producing of the MTEF of health to assist with effective planning and focusing of budget funds for health with the overall aim. Health services delivery in Samoa is accessible and affordable for all. To conclude, I would like to reiterate Samoa's support to endorse the Regional Action Framework for Health Financing to achieve universal health coverage and sustainable development in the Western Pacific, and looking forward to work hand in hand with the WHO and other member states to implement this framework.
Thank you. I call on the representative from Australia, followed by Japan.
Australia welcomes the Secretariat's work on health spending and supports the development of clear and decisive policy action to address current and emerging challenges and to continue progress towards UHC. We are all united by our experience of challenges in strengthening health systems, including addressing the rising costs of healthcare, supporting an aging population, the impacts of climate change, and more. The pandemic has highlighted the importance of investing in resilient health systems centered on primary healthcare. These health systems should be designed to adapt and effectively respond in times of increased demand and evolving population needs, while also maintaining core functions and service delivery. Importantly, they need to be financed in a sustainable way. In Australia, we are seeking to incorporate contemporary, value-based healthcare approaches to drive a greater focus on patient outcomes and value. Australia has a comparatively high level of investment in health, but the challenge to maintain quality, accessibility, and equity is ongoing. The delivery of health services is one of the 5 fastest growing areas of Australian government expenditure. As health funding is a finite resource, this requires developing innovative and dynamic funding models that are data and evidence driven. Of critical importance is shifting the conversation and approach towards preventive health measures. This must also be considered to support the sustainability of our health systems and is an area that benefits greatly from working across sectors to support the most effective investments in areas outside of health, such as education or environment, to deliver positive and equitable health outcomes. We recognise the importance of health financing for our region, particularly given the growing burden of NCDs and its vulnerability to external shocks, as I mentioned, such as climate change and health security threats. The framework offers not only a strong analysis of the key challenges the region is facing, but sets a clear course for addressing these. In particular, we acknowledge the need to continually improve the effectiveness and predictability of development assistance and reduce fragmentation of funding pools in support of equity and efficiency in health spending. Australia supports the endorsement of the framework on health financing to continue progress towards UHC. Thank you.
Thank you. I call on the representative from Japan, followed by Micronesia.
Thank you, Madam Chair. First of all, we Japan would like to express our gratitude to the Secretariat for drafting the Regional Action Framework for Health Financing to achieve UHC and sustainable development in the Western Pacific. To achieve UHC, it is crucial to strengthen health system, including establishing a sustainable health financing system through expansion of domestic finance for health and securing stable domestic resources. In this regard, we believe that strengthening health financing is essential. During our presidency of the G20 in 2019, we organized the first ever joint session of finance and health ministers. As other colleagues has already echoed, in the wake of the recognizing and highlighting the importance of finance and health coordination, currently we are preparing to establish the UHC Knowledge Hub in Japan next year, in collaboration with WHO and the World Bank. The hub aims to provide human resource development and knowledge sharing for achieving universal health coverage worldwide. One specific activity of the hub will involve supporting capacity building for finance and health authorities in low and middle income countries with the goal of strengthening health financing. Through initiatives including the UHC Knowledge Hub, we would like to contribute to achieving UHC in our region. I thank you, Madam Chair.
Thank you. Now I give the floor to Micronesia.
Thank you, Madam Chair, Regional Director, honorable colleagues, distinguished delegates. The Federated States of Micronesia affirms its commitment to supporting the WHO as we work to achieve UHC and health for all, ensuring that no citizen faces financial hardship in accessing essential health care. Like our sister island nations, FSM has made progress in enhancing health access over the last 2 decades. But we also recognize that ongoing challenges require a strategic approach to health financing. Our health sector development plan underscores our dedication to building a sustainable and equitable healthcare system with a strong focus on effective financing strategies to minimize waste and maximize positive outcomes. Central to our financial strategy is the Strategic Human Resource for Health Plan, which aims to address workforce shortages through targeted training and development. Investing in our healthcare workforce will enhance service delivery and ensure that high-quality care is available to all. We're also committed to expanding primary healthcare access. Our goal is to integrate services that promote early detection and management of health issues, thereby improving health outcomes and reducing overall care costs. Addressing the social determinants of health is another priority. By fostering collaboration between health and social sectors, we aim to tackle critical issues such as sanitation and nutrition. This holistic strategy not only improves health, but also leads to long-term cost savings and reinforcing investment in health. To invest data-driven decision-making, we will upgrade our health information systems and digital infrastructure. This will provide transparency in our financial practices, enabling us to track expenditures effectively and make informed decisions that benefit our population. Another vital aspect of our financial strategy is to reduce reliance on external aid. We plan to increase domestic revenue for health services through innovative funding mechanisms and explore prepaid health service schemes. These initiatives will ensure that all citizens can access care regardless of their financial circumstances, thereby protecting them from catastrophic health expenses. Additionally, we will review and optimize our social health insurance mechanisms to improve efficiency and equity, aiming to expand coverage for all formal sector workers. Our financial investments will be guided by cost-benefit analyses to ensure sustainability and effectiveness. In conclusion, FSM is fully committed to achieving UHC through our HSDP. By addressing health financial challenges strategically, enhancing workforce capability, expanding primary care, and promoting collaboration, we aim to create a resilient and equitable healthcare system that meets the needs of all our citizens. Thank you, Madam Chair.
I understand that there are representatives of non-state actors who wish to make a statement to the committee on this agenda item. It's my pleasure to ask the representative of the NCD Alliance to deliver a statement to the regional committee, please.
Thank you, Madam Chair. Regional Director Dr. Saya Piukala, honorable delegates and distinguished guests, the national NDC alliances of the Western Pacific region and the global NCD Alliance applaud the development of the WHO Regional Action Framework for Health Financing to achieve universal health coverage and sustainable development in the Western Pacific. We are concerned by the low coverage of NCD services and deteriorating financial protection in the region, caused at least partially by insufficient public spending and gaps in health financing policy. With this, the NCD Alliance strongly supports the adoption of the regional framework and calls on the member states to implement the following actions in accordance with the framework's 5 action domains. First, increase and sustain public funding for NCD prevention and control in a manner commensurate to the disease burden, with the aim of reducing out-of-pocket spending, particularly for vulnerable and marginalized groups. Second, introduce or increase excise taxes on products harmful to health, strengthen tax collection capacity, and boost prioritization of health within government budgets. Third, use evidence-based processes such as health technology assessment and other policy measures to facilitate decision-making on what services and goods need to be covered by public funds and initiate progressive efforts to cover the entire population. Fourth, invest in the reorientation of health systems that are grounded in primary health care. Fifth, ensure that existing and new funding for public health is applied for optimal impact and protected from the conflicts of interest from industry interference. Sixth, ensure and establish mechanisms for participatory budgeting and increased representation of patient and civil society groups in various health governance structures, including HTA. Sixth, invest in patient-based unified digital health information system that follows the movement of patients across facilities and schemes, enabling a patient-centered continuum of care. And finally, demonstrate co-benefits of intersectoral collaboration and implement cross-sectoral financing schemes. Thank you very much.
Thank you. May I now call on the Secretariat to respond to the points that have been made?
Thank you, Madam Chair. Let me first of all thank you all member states for this overwhelming and I would probably say universal support to the development of the Regional Action Framework on health financing. I also want to extend the thank yous for all of you because this is not a Secretariat product. This has been developed collectively with you, with your representatives. They have been consulted and also with experts from different parts of the region. So thank you again and congratulate all of us for the development of the framework. The second point I want to share is it's very encouraging to hear the willingness to share the experiences in each country. And I think that that's one of the strengths of this process. And we really need to tap into this willingness to share and share the lessons, what works and what has not worked, and to help each other on the developing of this difficult area. The third point is we note your recognition of the challenge on the need to increase domestic financing for health. The Western Pacific region is the lowest in terms of domestic out of total government spending on health. And I think that by recognizing this challenge, it's an encouraging step to start addressing this point. We should not forget that spending on health is a societal choice. So it is important that we all recognize this challenge and we are willing to bring this to the highest possible advocacy level to address that. The fourth point is you have, and we took note of your cost containment problems, the recognition that new technology, new medicines, the way how we are paying facilities are be challenging and are stretching our fiscal capacity. So we recognize that there is an issues of cost control, and this is not going to stop with the development of technology. We also recognize and we took note the link that you have made between primary health care and the need to finance and to make it more explicit when we have policy choices to put the resources where are more efficient. And this is where primary health care has to play a big role. Let's not forget 90% of the services that our people need could be delivered through primary health care. We should make health financing reforms to contribute to this strengthening primary health care. We believe, listening to your interventions, that the problem will not fix by itself. So we really need to put hard thinking. And we heard from a few member states expressing that they have developed or they are going to develop strategies and different reforms on how we are paying health services. We really need to work on this together. And as my last point, I want to reemphasize that you can count on WHO or all levels of WHO to facilitate and contribute on this difficult, hard thinking on health financing. Thank you very much. And now I want to pass the floor to my colleague from WHO Health Quarters, Dr. Calypso Chalkidou, is the Director of Health Financing and Economics.
Thank you. Thank you, Luis. I think the health financing framework could not have come at a more timely moment. The world is faced with a health financing emergency. We have a collapse in external flows, growing primary deficits, and unaffordable debt servicing, which, given how expensive money has become, may push countries from what is currently a liquidity crisis to a dramatic insolvency crisis. The global health financing architecture may no longer be fit for purpose. and it can't meet the need for large volumes of highly concessional financing, so that governments can spend more on health and education. And that's needed precisely because resources right now are so scarce and because we're faced with these fiscal headwinds. In 2024, the world's 75 poorest countries, about half of them are in Africa, will have to spend more than $185 billion, 7.5% of their combined GDP, to service their debt. That's more than what they spend annually on health, education, and infrastructure together. 2 billion people experience catastrophic or impoverishing health spending due to out-of-pocket spending on health in 2019. That's the most recent year for which we have data. So these numbers don't account for those who are too poor to spend any money to start with. And these numbers don't account either for the COVID shock, which reversed global trends in poverty reduction and pushed tens of millions into poverty. And here's the catch. Investments in healthcare and other SDGs need financial resources, but economic growth, which generates those resources, can't happen without improvements in health and education, which in turn are dependent on adequate funding. And that's why health financing and the discussion we're having is so important. Health financing is not an easy theme. It's perceived to be a bit too technical, hard to communicate. Investing in health financing capacity in people, in data and institutions is not an easy sell, unlike perhaps disease, technology, or population-specific programs. And yet health financing underpins all of the above, and it's critical when it comes to attaining and sustaining programmatic results, strengthening health systems, and then getting us to universal health coverage. And this is, I think, the value of this framework. It makes it simple, explicit, and elevates the importance of health financing as a means to multiple important ends, and most important of all, to achieving universal healthcare coverage. My colleague Luis has said it all, and it's heartening to see the encouraging messages from member states and all the amazing work you're doing in your countries. One thing I would call for is even more of your attention towards health financing data. Colleagues here mentioned national health accounts. We need data that are timely, that are granular, that are disaggregated, that are as complete and as accurate as possible. We need this data routinely collected and linked to health information systems. We need trends across time. And this is the sort of work supporting NHAs and systematic inclusion of health modules in household surveys, working together with offices of national statistics. That's absolutely critical to drive policy reform. Member states should really collect this data and share their data, and also use the data to monitor their own progress, to course correct, and to target the poorest and protect the poorest from financial toxicity. And to finish, I just want to say that UHC is really a wealth redistribution and financial protection intervention. It's about getting money from the rich to the poor and from the healthy to the sick. And its success should be measured by the extent to which it fulfills this role. The founder of the British National Health Service back in 1946, and this happened at a time when the country invested heavily in health whilst faced also with the most profound economic and debt crisis right after the Second World War. So he said that no society can legitimately call itself civilized if a sick person is denied medical aid because of a lack of means. And with that, I pass to our regional director. Thank you.
Yeah, thank you. And I would like to thank and commend our member states for your continued commitment to improve health financing in this region. This has been a very informative and interesting session. Your active participation, your thoughtful inputs during this session speak to that commitment, while also illustrating the complexities and stark differences in realities that countries face. There seems to be a consensus to endorse the Regional Action Framework for Health Finance to achieve universal health coverage and sustainable development. WHO will continue to work with you in this journey. Thank you.
Thank you, Dr. Piukala, Regional Director, Mr. Vinas Torres, and Dr. Chakido. It's now time for our coffee break. We are still running slightly ahead of the schedule. Thank you to everyone's efficiency. I'd like to ask that we stick to a 15 minutes break so that we can return to the session and have more time to discuss item 13, digital health. The plenary session will be reconvened in 15 minutes at 15:20 hours. Thank you very much. Welcome back. We now move to agenda item 13, digital health, document WPR/RC75/8. May I invite the regional director to introduce this item?
Well, good afternoon, honorable ministers, representatives from our member states. Before this item is introduced, I just found out just now that Director Kitong's birthday is today. So, and I want to wish him happy birthday, and I think it is appropriate for us to sing happy birthday to Kitong. Happy birthday to you, happy birthday to you. Happy birthday, happy birthday, happy birthday to you. And anyone, your birthday today is included in this happy birthday. So I'll hand over to Susan Mercado, the TBM, to introduce this item. Thank you.
Thank you, RD. Madam Chair, distinguished representatives, I'm pleased to present for your consideration document WPR/RC75/8 on digital health. The use of digital health technologies is growing exponentially, but we are still far from tapping the full potential of these technologies to help build better health systems. This trend was accelerated by the COVID-19 pandemic, which multiplied the demand for digital transformation to meet challenging health needs. Digital health solutions are already revolutionizing healthcare in the Western Pacific region. Enhanced telemedicine services, for example, in remote settings, are increasing the access to health services. Electronic health records are helping to increase efficiency and better inform patient care. Mobile health apps are enabling people to take more ownership of their health. And technologies such as artificial intelligence are being used to improve the precision of diagnostics, predict disease outbreaks, and increase the impact of public health efforts. This technological transformation, however, brings new challenges. To begin with, we must enact more robust governance measures, including legislation, because these collaborative solutions come with an expanded set of participants and issues. For example, how can we ensure financial sustainability with so many healthcare funding models? How can we guarantee the ethical use of technology and data? And who decides how advanced tools and technology will be employed? All of these questions are thoughtfully addressed in the draft Regional Action Framework on Digital Health in the Western Pacific, which, as you know, was prepared with extensive member state consultation. The framework advocates a whole-of-government approach to accelerate development of an innovative and participatory digital health ecosystem, one that targets delivering value through data and digital solutions to people and communities to achieve better access, quality, and sustainability in healthcare services. The framework aims to establish a coherent regional way forward to advance digital health by supporting in two key ways. First, guiding countries and areas in the region in developing national digital health plans. And second, facilitating collaboration with WHO to advance national digital health strategies that are aligned with country needs and priorities. The Regional Committee is invited to consider for endorsement the draft Regional Action Framework on Digital Health in the Western Pacific. Thank you, Madam Chairperson.
Thank you, Dr. Susan Mercado. I understand the Secretariat has prepared a video on this item. Please play the video. Thank you. We will now open for questions or interventions from representatives who wish to speak on this item. Please indicate your wish to speak by clicking the big button on your microphone, please. So I call on the representative from China, followed by Hong Kong, China.
尊敬的地区主任，尊敬的大会主席，尊敬的各位代表，中方对西太平洋区域数字卫生行动框架草案表示支持。
Work on digital health in the Western Pacific, which is expected to contribute to the realization of a people-centered digital health ecosystem in the region, while ensuring sustainable and measurable outcomes at the national level. Over the past decade, China has made significant strides in digital health by rolling out a comprehensive set of regulatory provisions and guidelines in Internet Plus healthcare services, big data applications and management in medical and healthcare, and AI integration in healthcare delivery. The implementation of these guidelines has yielded remarkable results, including new modes in the delivery of digital health service and innovation in digital health actions. Sample first, the establishment of 3,340 online hospitals now facilitate over 100 million online medical consultations each year, effectively complementing conventional medical services modes. Second, we've introduced a unified digital maternal and child health handbook, put in place a system that streamlines information management with one-stop services across the entire span of maternal and child health care, covering pre-pregnancy, prenatal care, hospital labor and delivery, child health care and immunization services. Third, we've explored ways of efficient, high-quality and low-cost cervical cancer screening with the aid of AI technologies. Now, even local townships, health centers offer this essential service using portable digital devices. Healthcare workers can scan and upload cervical cytology specimen to an AI-powered platform for analysis after automated slide preparation and staining, enabling digital processing throughout the screening workflow. This transformation has dramatically raised the efficiency, enabling thousands of cases to be processed daily, a sharp increase compared to the previous daily limit of 100 cases per pathologist. Regarding the implementation of the Regional Action Framework for Digital Health in the Western Pacific, China hopes the WHO will strengthen cooperation across the region in the research and development of cutting-edge technology, data sharing, professional talent cultivation, and privacy protection. We expect the expansion of AI applications, medical settings, and deployment of specialized robots for surgery, rehabilitation, and logistics. We must strengthen digital infrastructure and data resources, establish clear regulatory standards, and implement robust security protocols. We also support AI language resource sharing. We will continue to support the WHO's leadership and coordination role for health affairs, and the Western Pacific region will also have our support to play a greater role in regional digital health initiatives. We are committed to making positive contributions towards the building of a global community of health for all. Thank you, Madam Chair.
Thank you. I call on Hong Kong, China, followed by Cook Islands.
Madam Chair, Honorable Minister, distinguished delegates, ladies and gentlemen, Hong Kong, China would like to express our appreciation for the excellent efforts of the WHO's Western Pacific Regional Office in developing the Regional Action Framework on Digital Health in the Western Pacific. The Regional Action Framework, we recognize that digital health is not just a tool, but a transformative force capable of reshaping the way we deliver health services. The Regional Action Framework is a timely response to the diverse challenges we face in our health systems. It invites us to adopt a holistic approach, one that engages not only governments, but also communities, health professionals, and technology innovators. Over the years, the government of Hong Kong, China has been supporting digital health initiatives and investing in the digitalization of public health and clinical services in Hong Kong, China, aiming to improve the health of our citizens. In 2016, the government launched the territory-wide electronic health record sharing system, eHealth, which aims to facilitate private healthcare sectors collaboration and to enhance continuity, efficiency, and quality of healthcare. As of July this year, more than 6 million of citizens of Hong Kong, China, that is 80% of our population, has joined the eHealth to better address the changing healthcare landscape and public health needs. The government has announced a 5-year plan of eHealth Plus to transform eHealth from a health record sharing system into a comprehensive healthcare information infrastructure that integrates multi-functions of healthcare data sharing, service delivery, and care journey management. As we embrace the regional action framework, letting us remember that our goal is not just to adopt technology, but to create a healthier, more equitable future for every individual in the Western Pacific. Together, we can build a digital health ecosystem that is innovative, participatory, and responsive to the needs of our communities. The government of Hong Kong, China would be pleased to join other member states to endorse the regional action framework on digital health in Western Pacific. Thank you, Madam Chair.
Thank you. I give the floor to Cook Islands, followed by the Philippines.
Thank you, Madam Chair. Regional Director, Honorable Ministers, Development Partners, ladies and gentlemen, Kia ora. A regional action framework is essential for the health sector to leverage technology to improve patient outcomes, enhance delivery of healthcare services, and streamlining operations. The 5 domains of the framework, with the essential and desirable recommendations for member countries to advance national digital health strategies aligned with country needs and priorities, is well noted. The Cook Islands is in its early stages of planning for a 5-year digital health action plan. The discussion of the framework will guide the Cook Islands in the development of this plan, and we look to WHO for assistance. For example, socio-technical infrastructure. Cook Islands is currently in the process of rolling out Starlink to all 15 islands to improve the internet connectivity and the infrastructure within the Ministry of Health. Data security is important, especially in the Cook Islands. With the recent endorsement of the Cook Islands National Digital Strategy, cybersecurity policy is to ensure that all government data, including health, will be shared over the network is being shared on a secure network. Digital health solutions. Cook Islands is also in the process of rolling out Manage My Health, which is a software that allows patients to have access to their medical records in the palm of their hands. This is one way Cook Islands is looking to digitize patient medical records. Another software that Cook Islands is currently rolling out to the Southern Cook Islands is M-Supply. It is a software for tracking, dispensing, ordering pharmaceutical within the Cook Islands and New Zealand. With all these essential desirables, actions and recommendations of the 5 domain governance, socio-technical infrastructure, financing and economics, digital health solution and data, I agree that all the revised recommendations as they are relevant to help us develop our digital health strategy. Chair, I thank you.
Thank you. I call on the representative from the Philippines, followed by Micronesia.
Thank you, Madam Chair. The Philippines supports the endorsement of the draft Regional Action Framework on Digital Health in the Western Pacific. We commend the Data Strategy and Innovation Group for its pivotal role in advancing universal health care and fostering health system resilience through data, digital technologies, and innovation. The DSI's use of strategic foresight, digital health frameworks, and enabling innovation ecosystems laid the foundation for future-ready health systems across the region, which aligns closely with our national efforts. The DSI's work on the Regional Action Framework for Digital Health marks a significant step toward digital transformation in healthcare. In the Philippines, we echo this through our own efforts to accelerate digital health initiatives. Our 8-point action agenda includes leveraging digital health and technology for efficient and accessible health services delivery. We focus on digital health transformation to optimize service delivery, streamline processes and data management, improve the payment of benefits, and engage the private sector in digital health initiatives. To create a thriving digital health ecosystem in our country, we share the same directions and put a premium in building a robust governance and leadership systems for digital health, encompassing policy and regulatory frameworks, and enabling socio-technical operating environment for data and digital health solutions, rational financing, and multi-stakeholder, multi-sectoral, and cross-border collaboration. Moreover, to guide executive decision-making in planning and implementation, we are working to establish a public health command center. This will utilize data visualization and analysis techniques to provide timely, accurate, and actionable insights, enabling for more informed and efficient public health responses. We are also enhancing primary health care services by adopting digital health solutions to be future-ready. We have identified priority digital health innovation areas that align with our aspirations for a future-ready, resilient, and ICT-enabled health system. This agenda serves as a roadmap for integrating digital health into our public health sector, ensuring preparedness for emerging health challenges. While advancing digital health technologies, we give high importance to data privacy and its principles in the field of health. The Philippines Data Privacy Act regulates the access to personal data and ensures the protection of personal information while also ensuring the free flow of information. The principles of legitimate purpose, transparency, and proportionality should be taken into consideration in the draft Regional Action Framework on Digital Health, which involves a domain focusing on the gathering and processing of personal data. Moral and ethical standards in the handling of these data should also be observed. The Philippines stands ready to support the implementation of the Western Pacific Region's Action Framework for Digital Health, particularly in building capacities for innovation, leadership, and governance, and future-proofing health systems. We believe these efforts are crucial in ensuring that health systems across the region not only adapt to, but thrive in the face of future disruptions while addressing inequities and fostering resilience. Thank you very much.
Thank you. I give the floor to Micronesia, followed by France.
Thank you, Madam Chairperson, Excellencies, and distinguished guest delegates. The Federated States of Micronesia welcomes and appreciates the report. We highly support and anticipate the guidance of the Regional Action Framework on Digital Health in the Western Pacific for a well-setting fitted and people-centric digital health transformation within our nation. The nation's Healthy Framework 2024 to 2034 under the priority area of health information, planning, and surveillance is well aligned with the framework and committed to establishing data-driven and digital information systems that generate robust evidence to guide health action in policy formulation, service planning, resource allocation, and patient care management. Focusing and resourcing the 5 identified digital health domains of the framework, which are governance, socio-technical infrastructure, financing and economics, digital health solutions, and data will greatly help our nation realize a people-centric, comprehensive digital health infrastructure with high connectivity and a competent data management task force. Noting the digital framework's recognition, acknowledgement, and accommodation of the ever-changing digital landscape, FSM is assured that our nation's digital health ecosystem can be strengthened, supported, and sustained, a true fitted and people-centric digital health transformation realized, and that's by adopting the Regional Action Framework. That said, FSM again highly supports and join other members to endorse the Regional Action Framework on Digital Health in the Western Pacific. Thank you, Chair.
Thank you. I call on the representative of France, followed by Malaysia.
Madame la Présidente, chers représentants, nous souhaitons souligner la contribution de l'Académie de l'OMS à l'apprentissage numérique en santé. L'Académie sera inaugurée le 17 décembre 2024 à Lyon par le président de la République française Emmanuel Macron et le directeur général de l'OMS, Dr Tedros.
Emmanuel Macron and WHO's Director General, Dr. Tedros. We know that the use of digital technologies in health is a powerful way to tackle the major challenges that our health systems face. This is the reason why digitalization of functions and services of health systems are part of the French strategy for global health, so as to strengthen equitable access to quality health services. In 2023, France adopted a roadmap for the use of digital technologies in health, 2023-2027, entitled Digital Technologies for Health. This roadmap, which is based on ethics, sovereignty, and sustainability, outlines priority areas of work for the next 5 years and is articulated around 4 pillars. First pillar, prevention, develop prevention and empower individuals to take care of their own health. Second pillar, care, give time back to healthcare professionals and improve patient care thanks to digital technologies. Third, access to health, improve access to health for people and the professionals who guide them. Fourth, framework conducive to an increased use and greater innovation in digital technologies for health. As we know, digital health is playing an increasingly pivotal role in the lifelong training of healthcare personnel. The constant evolution of technologies requires training and support for healthcare professionals and access to tools and guidance. We welcome the draft Regional Action Framework on Digital Health in the Western Pacific, which highlights the need to assess the training and education needs of healthcare and IT staff and to define educational frameworks by adopting and adapting internationally recognized guidance documents. The WHO Academy, which will open its doors on 17 December 2024, will make tools and methodologies available to all of WHO and its member states. The Academy will be the WHO's learning hub for all those striving to improve global health outcomes, incorporating the latest innovations in digital health learning. It will help WHO achieve its ambition to become a pioneer provider of digital health learning and a global leader in the adoption of innovative approaches to health education. The Academy will support the implementation of the measures identified in the Regional Action Framework on Digital Health in the Western Pacific, in particular those aiming at offering lifelong education to health workers, decision makers, and civil society partners. We therefore suggest that a reference to the WHO Academy be included in the regional framework when mentioning training in digital health, for example, in page 25.
And affordable data management and storage solutions are prioritized, with an emphasis on mobile health initiatives tailored to limited resources available. Nous suggérons d'ajouter la mention suivante.
Suggest to add using tools provided by the WHO Academy. Also on page 27, item 3.4.1. Finally, these solutions also provide access to platforms, thereby supporting continuous education and training. We suggest to add in line with the WHO Academy, and also page 35. last paragraph,
contribute to assess
health and IT workforce training and education needs, and define educational frameworks by adopting and adapting internationally recognized guidance materials. We suggest to add in conjunction with the WHO Academy. Thank you for your attention.
Thank you. We will now suspend this item and reconvene tomorrow morning. After the close of today's session, there will be a side event on One Health here in the plenary hall. We will reconvene tomorrow at 9 a.m. in the morning, Manila time. I would now like to invite the Director of Administration and Finance, Dr. Langes, to remind us of the details.
Thank you very much, Madam Chair. As you mentioned, at 4 p.m. after this event, we will have the One Health in this conference hall. And after that, as communicated earlier, the informal consultation with member states, also known as the caucus, will be held also in this hall from 5:15 onwards. As you know, the caucus is attended by chief representatives of member states plus one. So we kindly ask you that all other participants should vacate this conference hall after the earlier event, One Health, following that event, so we can give way to the caucus in time. Additionally, I would like to remind everyone that transport back to the hotels will be available after these events. For those who have not yet received the airport transfer flyers, please visit the WHO desk at your hotels. We're also closely monitoring the changing weather conditions and the forecasts for tomorrow. And if everything goes well, then the session tomorrow will start, as the chair said, at 9 a.m. in this conference hall. And transportation, as always, will be available from your hotels from 8:30. But if you want to visit the exhibitions, you can come earlier at 7:15 or 7:30, depending on which hotel you are. If anything changes regarding the weather conditions during the night, we'll be in touch with you, and each hotel will have the information available in the morning to guide you. In case there are floods and we cannot access the building, we will inform you accordingly, but we hope that's not going to be the case. But thank you very much, Madam Chair.
Thank you, Dr. Landes. Thank you very much. Today's session is now closed. The room will quickly be reset for the side event on One Health. See you back tomorrow here at 9 a.m. to resume item 13, digital health. Thank you.
Excellencies, distinguished guests, welcome to the side event on One Health. We're going to quickly get started, but just to introduce myself, I'm Gina Saman, the Director of the Emergencies Program here in the Western Pacific. We're going to start with a video about One Health. What is One Health? IT team, over to you.
What are you talking about? You see One Health.
Eat healthy and exercise daily. We will have the energy to clean the environment and to take care of our pets well.
Human health, animal health, and environmental health is all together to become One Health.
We need to stand.
A life that we live together, human and animal.
One Health is a health that protects people.
One Health, chicken health.
Thank you, colleagues. It's wonderful to hear from kids in the region. Let's give them a round of applause. So the good news is it's a little bit more than exercise, diet, not too fat, not too skinny. So let's begin the session. Let's talk about One Health and the agenda today. But before that, let me turn to Dr. Susie Mercado, Director of Programs here in the Western Pacific, for some introductory remarks. Susie.
Thank you very much, Gina. Honorable ministers, heads of delegations, distinguished guests, ladies and gentlemen. It's an honor to welcome you to this special side event on One Health. As was mentioned during the proceedings, one priority in the new vision for the Western Pacific region is advancing health security preparedness, and the vision prioritizes One Health actions through political support for multi-sectoral approaches to health. Communities in the region must be protected from the impact of infectious disease, food safety incidents, antimicrobial resistance, and climate-related disasters. To achieve this, we must embrace new ways of working together to harness the collective strengths of the diverse countries and areas in the region. Advancing health security requires working collaboratively across multiple sectors, going beyond silos and taking a One Health approach. One Health recognizes that the health of humans is inextricably linked to the health of animals, plants, and the environment. These close links demand close collaboration, communication, and coordination across all sectors. The contribution of different sectors joining forces through a One Health approach is essential for implementation of the international health regulations. WHO has played a vital role as one of the 4 members of the One Health quadripartite, which also includes the Food and Agriculture Organization of the United Nations, the United Nations Environment Program, and the World Health Organization, the World Organization for Animal Health. The quadripartite promotes and coordinates multi-sectoral collaboration on One Health issues. Today's side event is an opportunity to reflect on the progress made toward One Health actions, not only at the regional level, but also globally. Many countries have established multi-sectoral coordination mechanisms in technical areas that demand a One Health approach. During this event, we will hear country examples of One Health coordination and good practices. We encourage everyone to share country-specific needs and challenges related to One Health coordination. So let's use this next 60 minutes to identify opportunities for optimizing One Health coordination across the region as we look to uncover shared solutions to shared health security threats. Thank you for your commitment to this issue and to protecting and promoting the health of people and our planet.
Thank you, Dr. Mercado, for those opening remarks. Colleagues, we'll start off with a short presentation on the regional and global progress on the issue of One Health, followed by a panel discussion and opportunities for questions, comments, and interventions. To kickstart this presentation, what we'll be talking about today is an overview of recent actions to spotlight country implementation and the good practices happening in the region, and then what can be further done to advance the multi-sectoral coordination and the political leadership needed in addressing the 6 action tracks. But starting off, what is One Health? The definition, according to the One Health high-level expert panel, can be seen on screen, and it's all about taking an approach that's integrated and unifying to addressing complex health challenges for humans, animals, plants, and the environment, recognizing their interdependence. It's about mobilizing sectors, different disciplines, and communities. As Dr. Mercado mentioned, we have a quadripartite with the Food and Agriculture Organization, the UN Environment Programme, WHO, and the World Organization for Animal Health. This started actually much earlier in 2010 as a tripartite with FAO, WHO, and WOA focusing on AMR, rabies, and avian influenza. But recognizing the significance of this approach, this One Health integrated approach, it expanded. And in 2022, the World Organization, the UN Environment Programme, in fact, joined to become quadripartite, recognizing the criticality of the environment in an ecosystem thinking when it comes to issues of One Health. In the region, the engagement is extensive from across all these 4 organizations, and each periodically we rotate who is chairing the quadripartite at the regional level. Currently, the WHO Office of the Southeast Asia region holds that chair and convenes monthly calls amongst these entities to coordinate and ensure ongoing activities, support to member states in a coordinated way. In terms of global action and regional action, a number of initiatives are ongoing. Discussions on One Health topics continue in the negotiations on the pandemic agreement. In G20 and G7 forums, we see continued attention to One Health, most recently in India for the G20, for the upcoming G20 meeting in Brazil. In terms of the COP on biodiversity and climate change in COP28, that led to the launch of the implementation guide for One Health joint plans of action. All of this seeing and mobilizing further political commitment and support to this important approach to addressing our complex health challenges. And of course, in our region, acknowledging the leadership and the declarations arising from the ASEAN and Pacific community on One Health. So it's an approach. One Health is an approach. What do we apply it for? So looking at the One Health joint plan of action, and the implementation guide, the emphasis is on 6 action tracks that you can see on screen. These benefit from that multi-sectoral approach, unifying thinking to deliver programs that strengthen our implementation and delivery of better health. So everything from the systems, the emerging zoonotic diseases, the food safety, the antimicrobial resistance. These programs benefit from One Health approaches, One Health thinking. In the region, One Health is a priority within the regional vision, weaving health for families, communities, and societies in the Western Pacific region. In it, it's articulated that it's important to protect populations from exposure and impacts of life-threatening situations. And the idea is to mobilize the political support for science-based interventions, policies, and actions, and to track our progress collectively through these 6 IHR core capacities that you report on each year as state parties to the IHR and the core capacity obligations. When we think about the activities, the actions that are being taken in countries in the Western Pacific, we can see that a lot is happening. In IHR joint external evaluations since 2016, 18 countries have assessed their capacities. In terms of the joint bridging workshops, national bridging workshops to look at the interface between IHR core capacities and performance of veterinary services, 5 countries have conducted this in the last few years. And half our member states have One Health coordination mechanisms that are continually being strengthened and evolving over time based on country priorities. So how is this impacting our core capacities? What you see is we can track over time our IHR core capacities relevant and that benefit from One Health approaches in laboratory systems, surveillance, infection prevention control, which touches on issues of antimicrobial resistance, zoonotic diseases, that animal-human interface, food safety, and chemical events. And what you can see in the middle is our average regional score in that core capacity. So if we pick the example of food safety, on average, our performance here is 61% amongst our member states, but the range is important to see. Some countries have highly developed, sustained capacities, what's defined as 100% core capacity, and we have some that remain at the most limited levels of 20%. These are what we need to co-track and co-monitor, and through our implementation of One Health actions, we'll be able to see progress. We can move this needle together through this body of work. With that, please also know that at the regional level, there is strong coordination within our offices on One Health. The regional director has established a coordination mechanism that reports to Cabinet twice a year to look at the 6 action tracks and our regional investments through our country offices and regional office in terms of supporting member states on One Health issues. So it's brought to the highest level of our coordination to ensure that we are impacting and supporting member states in their needs. At the heart of this is the Asia-Pacific Health Security Action Framework, recognizing that all of our One Health actions contribute to better health security. With that, colleagues, in summary, One Health is an approach. We can apply it to 6 action tracks, and it helps us deliver stronger designs and programs delivery. It's useful because it enhances our ability to address complex health challenges at the interface. It helps us meet the international health regulations core capacities, those obligations of state parties, and of course, it optimizes our delivery and efficiency in effectiveness in programs. With that, I thank you, and we will now turn to the panel discussion. Let me welcome Dr. Tim Armstrong, the WHO representative from the Lao Country Office, to moderate a panel discussion and the Q&A for the rest of this session. Tim, the floor is yours.
Thanks very much, Gina, and it's a real honour to have been asked to moderate this important side event, which will bring together experts and leaders from the region to discuss the opportunities and challenges in the implementation of One Health. I would like to introduce our first panellist. That's Dr. Haji Khalifa, Director General of Health Services, Ministry of Health of Brunei Darussalam. Dr. Khalifa, Brunei Darussalam has been exemplary in setting up the National One Health Coordination Centre. Could you briefly elaborate the reasoning behind such a coordination mechanism and how Brunei Darussalam went about it?
Am I on? Okay. Thank you, Tim. Your Excellency, Regional Director, ADG, moderators of this event, distinguished fellow panelists from Vanuatu, and fellow delegates. It is an honor for Brunei Darussalam to share our journey and our small contribution to the collective efforts in advancing One Health globally. Now back to your question, Tim. Brunei Darussalam's One Health journey is still in an infancy stage and has been inspired by the collaborative efforts of the quadripartite organizations, the WHO, FAO, WOAH, and the UNEP under the One Health Joint Plan of Action. And regionally, we are also guided by the ASEAN One Health Joint Plan of Action, also called as ASEAN OHJPA. Everybody remembers about the IHR JEE, and Brunei underwent the JEE in 2019. And from the JEE, we recognize that even though progress has been made in certain specific areas, but there are also other areas that needed strengthening in operationalizing our One Health mechanisms. And while significant strides have been made, as mentioned, areas that require further strengthening and consolidation, especially with the other sectors. Now, I'm not sure if everybody here recalls on the experiences in the past experiences in the past 2 decades about JEs and recently about rabies. We underwent the same experiences. And when we had these concerns raised in Brunei, we had to create task force. So for JE, we had to create a task force on JE. For rabies, we had to create a task force on rabies. And we cannot simply go on and on and on creating so many task forces. And similarly, for AMR, we do have a separate AMR committee currently, which addresses some key health threats within the One Health approach. So from these experiences, the rabies task force has been expanded to the zoonotic task force about 2 years ago, and leveraging from early experiences from managing rabies to now jointly to address cross-sectoral issues, the scope of which has been expanded to include other priority zoonoses. Additionally, we also recognize relevant capacity needs for prevention, timely detection, and rapid response to emerging zoonotic diseases, which are yet to be addressed, particularly in the veterinary public health sector. We cannot forget our animal health sector. Historically, our efforts to address zoonotic diseases and combat antimicrobial resistance were effective, but largely operated in silos, which highlighted the need for a more cohesive mechanism to enhance national resilience and sectoral recognition. So learning from these past experiences, we recognize the urgent need to formalize an integrated approach to managing cross-sectoral health challenges, and we have recently established the National One Health Coordination Centre. And this centre will serve as the cornerstone of our One Health strategy, facilitating better coordination and collaboration amongst the various relevant sectors. These National One Health Coordination Centres' main objective is to institutionalize a One Health approach within a whole of government coordination framework, supported by policy and financing mechanisms aimed at safeguarding public health. And this center also aims to ensure a comprehensive, integrated framework for surveillance, monitoring, and response to zoonotic diseases, emerging pathogens, environmental challenges, and AMR across all the sectors. And most importantly, we recognize that this will be a gradual process. It cannot be an overnight venture. And we recognize that there are different starting points of each sector with regards to One Health, and allowing each sector to build on its unique strength and address specific challenges. By understanding the key areas of alignment, we hope that we can develop tailored strategies that support gradual and sustainable integration across the sectors. And it will also focus on capacity building through continuous education and training of the local workforce, and improve collaboration among the relevant sectors. How we aim to achieve this, and this is done by developing a cross-sectoral cohesive strategic plan and roadmap through a natural bridging workshop which is planned in early 2025, together with the assistance and available support from the WHO and seed funding by Global Affairs Canada, which enables the recruitment of specialized personnel and the initiation of capacity building initiatives. This One Health Center is expected to enhance our capacity for rapid response to emerging health threats nationally, as well as to foster stronger collaboration with regional and international partners. So it's not just for our national interest, but it's also for regional and international interest, and ensuring our efforts are informed by global expertise while being tailored to our local Brunei context. Thus, the center represents a significant advancement in our public health approach, strengthening our surveillance and response capabilities while building the institutional resilience that is needed to address these complex challenges. I shall stop here because I would like to let my colleague here to also speak. Thank you.
Thank you. Thank you very much, Dr. Haji Khalifa, and not putting you and our second panelist on the spot, but if member states do have questions, I'm going to open that they can ask questions to you on that very impressive experience from Brunei Darussalam. I heard three things coming across in your presentation: coordination, consolidation, and formalization. Now, please, time to introduce our second panelist for this afternoon. That's Dr. Posikan Samuel Tapo, Acting Director General, the Ministry of Health of Vanuatu. Acting DG, Vanuatu has established a One Health Committee. Can you tell us who are the main players and how it is coordinated with the other multi-sectoral mechanisms? Thank you.
Thank you, Dr. Tim. So in Vanuatu, a health security task force has been established as a multi-sectoral coordination mechanism to guide and oversee health security matters, strategies and plans under the National Security Council, and it's chaired by the Prime Minister, which the Honorable Minister of Health is a member of a 5 panel. In line with the IHR requirements, the One Health approach is led by the One Health Committee, and which was recently set up in 2023 under the Health Security Task Force, which reports to the National Security Council. Umbrella with a robust membership of key stakeholders with various sectors, ensuring there is a diverse expertise in addressing issues involving. Members are the directors of the departments of various government ministries. The chairman is for the committee is the Director of Public Health that sits with the Ministry of Health. The Secretariat is the manager for the Surveillance Unit at the Ministry of Health. The Deputy Chairperson is the Director for Livestock under the Ministry of Agriculture and Livestock, Forestry. And other members includes the Directors of Health, Curative and Hospital Services, Director of Fisheries, Director of Agriculture, Director for Biosecurity, Director for Meteorology, Environment, Water, the Director for Local Authorities, they're responsible for Area Council and Area Administrators, as well as representative from non-government organizations such as WHO, SPC, FAO. The One Health Working Group has been established in preparation of a joint external evaluation to be conducted in Vanuatu in 2025, which is next year. Its members are the technical officers from the Ministry of Health and the Ministry of Agriculture, covering areas of AMR, zoonosis, food safety, IPC, biosecurity, and all the ports of entry. So that's the Ministry of Public Works, Immigration, Customs. Thank you.
Thanks. Yes. Thanks, Dr. Posikai. I've just got a follow-up question in relationship to that. Do you have any concrete example in Vanuatu where the One Health approach has been implemented to date?
Thank you, Dr. Tim. I'll give 2 examples. Firstly is the leptospirosis outbreak investigation and response, and that's the collaborative efforts that we had with the Ministry of Agriculture, Livestock, Forestry and Biosecurity to investigate the leptospirosis outbreak in the Honorable Minister's Island, Ambai, in Vanuatu. We highlighted the inter-ministry cooperation in managing zoonotic diseases, and the investigation team involved multi-stakeholders, including Livestock in the Department of Agriculture, the Ministry of Health, Ministry of Education as well, the local government authorities under the Ministry of Internal Affairs. And we showcased a more community-oriented approach in terms of responding to leptospirosis. The other example is fish poisoning or ciguatera fish poisoning investigation, and the partnership was between the Ministry of Health and the Ministry of Fisheries, the Department of Fisheries, and the specific province that was affected was Shefa, the island that accommodates the capital, Port Vila. And we addressed the fish poisoning, demonstrating critical interactions between the environmental health through fisheries, human health, and we aimed in improving the investigation of fish poisoning cases and pinpointing the sources of contaminated fish. And it also linked to the Ministry of Climate Change in terms of coral bleaching. So for One Health research activities, we also partnered with Institute Pasteur from New Caledonia. Doing field investigations were conducted to trace the source of infection. In a human case, we did a comprehensive One Health approach where water, soil, animal samples were collected to determine the origin and the transmission of the infection at community level in collaboration with Institute Pasteur. Various sectors were also involved with the Ministry of Health. This includes the Department of Environment, the Ministry of Agriculture, Biosecurity, Livestock. And there was an initial meeting that happened to investigate the new potential zoonosis in Vanuatu. And we also expand the scope of our work to include flying fox for hemolytic fevers. So the One Health meetings that were conducted in Vanuatu, for these particular examples that I've given, was held with different stakeholders to be able to provide awareness, especially within the offices in terms of how the Ministry of Health involved with the other sectors. One thing that we have noticed in government is that most ministries are more vertical. They focus only on what is their priority. So it's more awareness within the offices as well, and bringing everyone together when providing current issues or what will be our report to the international health regulations. So the key challenges, Dr. Tim, limited resources for our island, capacity building, zoonotic transmissions, so that's understanding and managing diseases that transfer between animals and humans remains, it still is a challenge for us. Climate change and environmental degradation, and these factors of exacerbate public health risks and complicate response efforts, and the uses of data in terms of enhancing data collection, sharing, and integrating across sectors is essential for informed decision making. And I think just to conclude, the One Health initiative in Vanuatu embodies a proactive approach necessary for addressing complex health challenges by creating collaboration among diverse sectors and promoting capacity building. Vanuatu can improve its resilience to health threats while safeguarding public health, animal health, and environmental areas. And finally, emphasizing ongoing collaboration and addressing challenges head up and propel the One Health initiative towards achieving our goals. Thank you.
Thanks, Dr. Samuel. Very, very comprehensive intervention with some excellent examples of implementation in Vanuatu. Colleagues, when we were putting this panel together, we realized we had the opportunity of still having Assistant Director General Dr. Lee Alan with us today. And seizing on that opportunity of having Alan Yu with us, ADG for UHC Healthier Populations, but in the context of this discussion, responsible for One Health initiative at WHO headquarters. We thought we'd, and thank you for agreeing to also participate. Dr. Alan, what are the key enablers that drive successful implementation of the One Health approach?
Thank you very much, dear team. You are having best job as WR in the organization. I used to be WR, I know that. So let me also take this opportunity to express my heartfelt appreciation to Adi, or the Honorable Minister, my dear colleague and friends, because this is the first time I speak sitting in this room, and I'm leaving tomorrow, so thanks for that. My warm greeting to all of you today. After listening carefully to the example and experience challenges from my colleague in Brunei and Vanuatu, and it's really inspiring and encouraging. Without follow my message, let me share with you in a global discussion. One question we receive continuing is how can we operationalize One Health at country level to see the impact? Today, we learn from WEPRO member states for such encouraging example. Let me just highlight or reconfirm 3 things in order to respond to your question. And this is reconfirm each other. The first, political will and commitment. There's no doubt that political commitment will drive the One Health governance, the cross-sector coordination, communication, and financing. WHO works very closely with member states, including through global platform, as Gina mentioned, G7 and the G20, to generate and maintain the momentum on the One Health. The ongoing member states-led pandemic agreement negotiations provide another historical opportunity to commit politically to promote One Health for the pandemic prevention, preparedness, and response. Second, science and evidence-based policies for decision-making. The quadripartite has established this One Health high-level expert panel, really try to review all the science and evidence, provide member states with evidence-based advice for policy decision. The experts come from all the region, including WHO Western Pacific region, for example, Australia, China, New Zealand, and Vietnam. And third, country-led implementation. We are struggling effective implementation at country and the local level. So effective implementation should be tailored based on the country's system, context, and the needs. So in short, it is also very important to connect 3 things: the political commitment and the technical capacity and operational tools. We often see disconnection between 3. So I really think this is essential to connect them to implement One Health approach for the co-benefit. So WHO, in particular headquarters here, we are ready to provide the technical and other support, in particular led by country office and the regional office here, to ensure One Health action in the country will benefit for all health of animal, human, ecosystem, as what the amazing video mentioned, inspiring future generation. That's the One Health we can help. Thank you.
Thank you, Dr. Alan, and thank you to all our panelists. I'm now going to open the floor for interventions from member states. We'd like to hear your experiences, what you may have planned moving forward, questions to the panelists. So with that, you know what to do. Please press the buttons on your microphones as per usual practice, and we will start the member state intervention session. Thank you. I see Philippines. Thank you.
Thank you, Dr. Armstrong. Esteemed ministers and colleagues, good afternoon. The Philippines acknowledges the critical role of the One Health approach in fostering a multi-sectoral collaboration and transdisciplinary action for sustainable and holistic prevention, detection, and response to public health threats and emergencies. Our commitment to this framework has enabled us to enhance our preparedness and response capabilities across human, animal, and environmental health sectors. The country has made significant strides in implementing the One Health approach, particularly through governance mechanisms and multi-sectoral plans. Our partnership with the WHO and other quadripartite organizations has strengthened our coordination efforts, allowing us to effectively tackle the health challenges such as zoonotic diseases and antimicrobial resistance. Central to our progress is the Philippine Interagency Committee on Zoonosis, which serves as a sustainable governance platform to unify the efforts across the national government agencies in charge of the three sectors and ensure a cohesive approach to preventing and managing infectious zoonotic diseases. This collaboration is evident in our two-year rotational leadership structure, which fosters shared commitment and accountability among all sectors. In 2022, we facilitated the International Health Regulations, or IHR, Performance of Veterinary Services National Bridging Workshop, which aligned our strategies across sectors and established a joint roadmap to enhance our collective response capabilities. The National Action Plan for Health Security in 2023 to 2025 developed through inclusive stakeholder engagement key deliverables such as joint simulations to evaluate the local capacities for surveillance and response. In addition to this field, CZ, the Philippines has also established the Interagency Committee to combat the antimicrobial resistance. This committee employs the One Health approach to comprehensively address the escalating challenges of antimicrobial in our country. We are currently finalizing the second iteration of our National Action Plan on Antimicrobial Response, which will serve as a robust framework for our ongoing efforts to tackle AMR. We recognize challenges that remain, including the need for a comprehensive legal framework to streamline governance and coordination, as well as the establishment of interoperable data sharing systems among sectors. To address these gaps, we recommend WHO support in developing One Health strategic plans and facilitating the sharing of best practices among the member states. The Philippines stands firm in its resolve to strengthen its capacities through the One Health approach. Thank you very much.
Thank you very much, Philippines. Now my pleasure to give the floor to my neighbour, Tonga. Thank you.
Thank you, Honourable Chairman and honourable members, delegates, ladies and gentlemen. I know there's a typhoon coming, so I'll be brief. I have a long intervention here, but I'll try to summarize it during this intervention. Yeah, firstly, Tonga acknowledges this panel. I think it's a very important topic. For us, of course, One Health is a priority for us. We use it all the time. And as an example, I'll just give you a few examples. One of them, of course, the appointment of the CEO as the IHR national focal point is very, very effective when it comes to our responses against emergency situations. For example, during the recent volcanic eruption in Tonga, followed by COVID-19, we were able to effectively work in a multi-sectoral approach using partners in a One Health kind of approach. So we felt the response was pretty effective. Other examples, of course, acknowledge the tools provided by WHO in terms of IHR monitoring and evaluation framework, MEF, like the SPA, I understand that state party self-assessment reports, the joint external evaluation, the after-action review, and of course the newest strategic tool analysis for risk, the STAR. So we are using these to develop our national action plan for health security. And during the JEE, it's interesting that we found out, apart from the usual health risk, we found out that illicit drugs is also a risk. So illicit drugs, of course, is an issue that aggravates mental health, and of course other social issues. But we are going to include that in our national action plan. Just want to table it here for your interest, and that there will be a forensic component of our national action plan for health security. Of course, like what Vanuatu is saying, we do have our antimicrobial resistance plan, which was established in 2018, and we have a committee following that one up. But since the pandemic, COVID-19 pandemic, it's kind of stopped working. Of course, we have surveillance capacity being built in the lab to try to identify things, and animal production and health. We have a fairly strong collaboration with the Ministry of Agriculture and Animals. They have a strong collaboration with Ministry for Primary Industries in New Zealand, and also the Secretariat of Pacific Community, SPC, in driving that initiative. Of course, there is an Animal Diseases Act in Tonga, 2020. In terms of surveillance for prevalence of zoonotic diseases, that still needs, there's a little bit of gap there. There still needs to have some more research to establish. It's there, but I think the data is not coming forth. Otherwise, these are just examples of efforts that we have of Tonga's commitment to enhance its health security and emergency preparedness through multi-sectoral and One Health approach. Thank you.
Thank you, Tonga. Now my pleasure to give the floor to Cambodia, to be followed by Palau. Cambodia.
Thank you very much, Chair. Excellency, ladies and gentlemen. First of all, allow me to express my sincere thanks to all presenters for sharing valuable experience on One Health approach. As you all may know, many countries, including Cambodia, has established multi-sectoral collaboration mechanism on technical area that demand a One Health approach. Today, side event is a platform or dialogue on way to optimize coordination among the sector. It is a forum to share good practice and challenge by contributing to discussion, sharing insights, experience, opportunity for enhancing One Health coordination, particularly in preparing for and responding to complex health challenges. Cambodia established an interministerial coordination committee on One Health called IMCCOH, which is composed of Ministry of Health, Ministry of Environment, Ministry of Agriculture, Forestry and Fishery, and chaired by the Ministry of Health. The purpose of this interministerial committee is to oversight and strengthen policy, communication, collaboration, and strategic action for AMR, emerging infectious and zoonotic disease across the countries. Cambodia has recognized recent achievement and effective multi-sectoral collaboration using a One Health approach. Cambodia has successfully secured additional investment from bilateral partners to accelerate national and subnational response to AMR. This represents a substantial investment in strengthening AMR using One Health approach and is anticipated to start in 2025, next year. Cambodia is also looking forward to work with WHO member states and all stakeholders to achieving health of human, animal, plants, and environment. Thank you very much.
Thank you very much, Cambodia. Now my pleasure to give the floor to Palau.
Thank you so much, moderator, and I also would like to thank the panel for the wonderful discussion on our topic of One Health this afternoon, particularly Vanuatu and Brunei. Darussalam, for your excellent examples of how you're progressing with One Health in your respective member states. I just have one concern, which I guess will lead to a request. In Palau, and I'm pretty sure it's the same with other Pacific member states, one of the challenges that our other sectors, whether it be agriculture or livestock or the environment sector, still regard One Health as a Ministry of Health responsibility and not necessarily a shared one. And I know very well that around the table and in the room, we know the importance of this concept. And Palau appreciates the One Health joint action plan that with the intent of implementing it at the national level. But how can we assist each other in better packaging the concept and engaging other sectors, not only for their involvement, but also their ownership in playing their part in the One Health concept? And so I think the plan is great, but then how do we then communicate that to other sectors for their buy-in and their stake? The other thing is, how can we mainstream the concept of One Health and as a framework that we can actually use for anything and everything else? I don't think this should be regarded as a standalone initiative, but rather something that evolves and eventually should be one of the underlying frameworks that we base all of our public health strategies and initiatives under. And so we appreciate the continued work on the concept of One Health and the continued development of One Health as a framework. And we would like to see that perhaps we can regard it more as an underlying framework rather than a standalone initiative. Thank you.
Thank you very much, Palau. I don't see any other member states wishing to take the floor. If not, I'm actually going to ask the panelists, and sorry to do this unannounced, but we heard two interesting questions or concerns from Palau, and just wonder if from the panelists, if very quickly you could address any advice or your experience in relationship to the issues of the perceptions of the One Health initiative being within the remit of Ministry of Health, and also the advocacy and framing of One Health. Maybe I'd ask Dr. Khalifa first, please.
Thank you very much, Tim, for the offering me to answer the question. I know that Dr. Posikai was gearing to answer it earlier. For us, I think the most important thing is engagement and education and relaying the correct information. We've had so much misinformation in the past, and especially within the public, and as well as within the other sector as well. It's correct that what our colleague from Palau has mentioned just now, we also experience the same thing. They consider anything to do with health and the final impact on health, on human health, then they will say it's a human health matter and it's nothing to do with them. But what we did was, in terms of constantly engaging them and harassing and knocking on their doors, and I think that somehow works, and it somehow finally sink in. I think probably one of the examples was, I think I quoted early on, was in terms of example with our JE experience as well as rabies. We could not, for rabies, we cannot deny the fact that from the wildlife sector is the most important sector, even though at the end of the day, the impact is on human health. but there is definite and major risk if this is not handled by the animal and wildlife sector. So constant engaging, constant information and educate, as well as with public engagement and the use of social media. So that we think that that is one of the approaches that we think that could help. Perhaps Dr. Tosika would like to answer.
Dr. Samuel, yeah, sorry, thank you.
Yeah, thank you, and thank you, Honourable Minister from Palau, for raising that question. It is something that Vanuatu also experienced, and one thing that we did is that the provisions of our Public Health Act doesn't give that power for us to call a meeting involving the other sectors. So we have elevated through the Office of the Honourable Minister, elevated it to the Prime Minister's Office under the National Security Council. And under the National Security Council, the Prime Minister chairs a four-minister membership, which the Honourable Minister of Health sees there any agenda in relation to security is tabled to the National Security Council. And from there, the National Security Council gives instruction to all ministries for us to coordinate a working group. And that's how we came up with the Health Security Task Force, also forming the One Health Committee as well. So I think it's more about who have more authority in terms of calling all of government departments together. We have used the same concept in terms of NCD. And sorry for bringing this in. NCD has been an issue at the ministry. We tried to raise it. Budget was not enough. We elevated to the Prime Minister's Office. It's now an agenda under the National Security Council. And then from there, we see now funding coming in to support our work on NCD. So I think that's just an example that I just wanted to. Thank you.
Excellent. Thank you both very much for those responses. And I hope, Palau, you were inspired a little bit by that. We've actually only got 3 minutes left, so I'd like a round of applause, please, for our panelists this afternoon, and all the member states who contributed with their experiences and concerns. I'd now like to hand the floor back to Dr. Gina, who will give a summary. And again, thank you from all the participation from my side today. Back to you, Gina. Thank you.
And let's give a round of applause to Dr. Tim Armstrong. Thank you. Thank you, panelists. Thank you, speakers and distinguished guests, for those excellent interventions. We hear you loud and clear. Philippines, we're full support of the need to share best practices, to support strategic planning. Palau, with those challenges indeed, and let us know where the quadpartite can absolutely bring its the languages of different sectors to speak to their sectors and to help also bring that from a perspective of different agencies coming together in support of these initiatives. Thank you. In summary, what a wonderful session is all I can say. We've heard about One Health. We've heard about how countries are going about articulating their needs, the priorities, addressing the silos, addressing at the heart of it real life challenges. One Health is an approach, but it tackles real-life challenges from AMR to the topics of emerging diseases to issues on the impacts of climate change. Truly, we've heard many examples today of where it serves a purpose. We heard about the importance of mobilizing the enablers of technical, political, and the tools and designing them to context, to fit the needs of context. With that, we really see the focus on this to ensure that you in your leadership to move forward and provide that political commitment for policy, financing, implementation, and delivery. And of course, the quadpartite starts with you in this journey. With that, we look forward to implementing further with you as we move along in our implementation of the regional vision, with its endeavor to further protect the health of our communities and, of course, in strengthening health security. With that, let me thank the members of the panel again. With Dr. Khalifa, Dr. Pasakai, Dr. Aylan, very grateful for your reflections, to member states for their interventions and support, Tim for excellent moderation there, and of course, we work across the 6 action tracks. And so even though the Health Emergencies Program is hosting today, but let me acknowledge my fellow WHO directors and programs and country offices in their roles on the different aspects of implementing One Health. The One Health working group in our office that spans the different divisions. Let me acknowledge my team who made this happen as well today, Jessica Lopez Kayamori, who was an instrumental MC in our dinner on day 1. Thank you for the hard effort and work, and of course to everyone involved in preparing this. The video, those kids come from across the region, and it's always a fabulous thing to see the future speak about our needs as well. RD, DPM, comments from you? Happy to close.
Yep. Thank you, Gina and the team. Thank you, team. Can we all another round of applause to all the team? Team Gina and their team who makes this possible. And I think this is a very important topic, which is also a priority in our region. So, as you have seen, our children, you know, and the panelist has said the importance of raising awareness, education. It is very important. And I also want to acknowledge the ADG, Dr. Lee Island, who will be leaving us tomorrow. Thank you for joining us from HQ, and send our love to HQ when you return, and safe travel. Thank you. So thank you all member states. Thank you for all your active participation in this important, and have a restful evening. And we do hope there won't be any typhoon tonight. So we can see you tomorrow, as the Madam Chair said, 9 o'clock tomorrow. Thank you.
Thank you, RD. And now let's turn to Dr. Tamas for some announcements.
Thank you very much. Thank you very much, Gina. Thank you very much, Chair. Just as communicated earlier, I would like to remind everyone that the informal consultation with member states known as the caucus will begin in this room in about 12 minutes at 5:15. As you know, the caucus is attended by a limited number of participants. It includes the chief representatives of member states plus 1, and would like to ask all other participants to kindly vacate the room by 5:15. Thank you so much. Have a great evening. See you tomorrow. Thank you.